Hi, and welcome back to our podcast, Among Therapists, Practical Tips by Psychotherapy Academy. I'm Dr. Jessica Díaz, and I am an editor at Psychotherapy Academy, and I'm so glad you're joining us again. Today, we're going to explore the concept of getting unstuck in therapy, particularly through the lens of acceptance and commitment therapy, or ACT. As psychotherapists, we understand the importance of our role in enhancing well-being and recognize the complexities of our work. To support you, we offer practical tools and insights through our membership system, Therapy Pro, featuring our exclusive activity clinical cases. Here, expert clinicians unravel complex case conceptualizations, offering you not only knowledge and tools, but also CE credits. In line with this, we've prepared some special episodes, including today's, offering glimpses into clinical cases with expert discussions on various conditions. Our focus at Psychotherapy Academy extends across various therapeutic approaches, including DBT, ACT, couples therapy, and more, equipping you with strategies and frameworks for your clinical practice. We invite you to take a look at our website at psychotherapyacademy.org. In this episode, we'll focus on Charles, a client grappling with social anxiety, and how cognitive diffusion in ACT helped him move forward. ACT is not just about reducing symptoms, but also about fostering meaningful and values-driven lives. We explore techniques like cognitive diffusion, helping clients shift their relationship with their thoughts, which is crucial for their journey towards a values-aligned life. Clients often seek help for challenging emotions, such as anxiety or depression. Our goal is to aid them in reconnecting with their values, empowering them to live authentically despite these challenges. Our faculty member in this presentation is Dr. Brian Pilecki. Dr. Pilecki is a clinical psychologist with a wealth of experience in treating anxiety disorders, trauma, and PTSD. He skillfully integrates mindfulness and meditation into his therapeutic approach. His research spans anxiety disorders, mindfulness, psychedelics, and the interplay between theory and practice in psychotherapy. Let's dive into the transformative journey of Charles and discover how ACT can help clients like him get unstuck and live a life true to their values.
Once I had some sense of values that were important to Charles, another ACT process that I might move towards is diffusion. So as mentioned, Charles reported some difficult thoughts or beliefs that are relevant to his social anxiety. And cognitive diffusion refers to the process in which we can get really stuck to thoughts. We have thoughts that are not really helpful to us in terms of living a values-based life or a meaningful life. So Charles said things like, I'm an idiot, or I can't meet new people. And those types of thoughts or beliefs are good targets for diffusion exercises. One diffusion exercise that I might introduce with Charles is a very basic and quick one where I might have him restate the thought with the phrase, I'm having the thought that before it. So if Charles says I'm an idiot, I might ask him to say, I'm having the thought that I'm an idiot. Or instead of, I can't meet new people, he might say, I'm having the thought that I can't meet new people. And that changes the relationship to that thought. And that's, again, part of the goal of ACT is we're not going to try to get rid of those thoughts, but we can change the way one relates to those thoughts, or we can change what one does when those thoughts show up. Another metaphor that I like to use for diffusion is the idea of an infomercial, which are those commercials on TV for ridiculous products that everyone knows really don't work and are really just junk, but yet somehow can tempt us into purchasing them because maybe we want to believe it. And so our minds can often function in the way as a good commercial. They really get us to buy into certain things or certain products and convince us that things are true. And so what I might do with Charles is actually watch a commercial, watch an infomercial with him. There's one that I really enjoy. It's a product from the 90s called the Flowbee. It was this really awful home haircut system that looked like a vacuum cleaner that would cut your hair. And you watch it and you laugh. And it's really a silly product. And after I show this to Charles, I would ask him, would you buy that? And reliably, I'm sure Charles would say, no, I would not buy that. And I would say, why? And he might explain why. And I would then ask him, what if you were to take that same approach to, I'm an idiot? Do you have to buy into that? Or the thought that I can't meet new people, right? Is that a thought that you really want to buy into? And sometimes I'll say to clients, this is based on a study that I like to cite, that we have 60 to 70,000 thoughts per day. So that's a lot of thoughts. And we can choose which of those thoughts we prioritize, which of those we give authority to, which ones we allow to influence our actions. Another metaphor that I might use is I would ask Charles, do you have an email address? And how many emails do you get per day? And do you open each email and read each email with the same degree of attention? Most people would say no. Instead, what I do is I open the ones that I want to read and ignore the others, right? And so that we can take that same approach to our thoughts. The thoughts that are useful, those are thoughts that we can give more weight. And the thoughts that aren't helpful, we don't need to get rid of them. We can allow them to be there, but we don't have to give them authority. And I might also do a very classic thought suppression exercise with Charles to demonstrate that when you try to argue with thoughts, that it actually makes them bigger. And so the classic exercise is, don't think of a white bear for a minute. And I would start a timer and actually have Charles try to not think of a white bear for a full minute and ask him afterwards how successful he was. And that demonstrates this principle that the more we try not to think of something or push thoughts away, it actually gives them power and they rebound and get bigger. So the process of cognitive diffusion is not about getting rid of the thoughts. It's about just not buying into them, not giving them credence over our lives. And this might be an alternative to what Charles worked on with his former therapist. And with traditional or other forms of therapy, if a client says, I'm an idiot, you might provide evidence for them that they're not an idiot and try to convince them of a different belief about themselves. And again, using cognitive diffusion, we would take a different approach. So another approach might be just to ask Charles, when you have that thought, I'm an idiot, does that believing in that thought help you move towards a life worth living? Does it help move you towards what matters? Or has it made your life smaller? And if that's the case, then maybe you don't need to give that thought the power that you are giving it right now.
Okay, so that was an insightful discussion on cognitive diffusion in ACT with Dr. Brian Pilecki. Let's take a moment to recap the vital concepts we covered. Cognitive diffusion is a core process in ACT, helping clients like Charles to change their relationship with unhelpful thoughts. Charles, dealing with social anxiety, learned to reframe his thoughts. Instead of saying, I'm an idiot, he practiced saying, I'm having the thought that I'm an idiot, altering his engagement with these thoughts. We explored metaphors like the infomercial and emails. Just as we wouldn't buy every product advertised or open every email, we don't have to buy into or open every thought our mind presents. This approach teaches us to prioritize thoughts that align with our values and dismiss those that don't serve us. The classic thought suppression exercise involving the white bear demonstrates the futility of trying to push away thoughts. The more we resist, the more they persist. In contrast to traditional therapies that might challenge unhelpful thoughts directly, ACT focuses on whether such thoughts contribute to a meaningful life. Through cognitive diffusion techniques, clients can recognize thoughts as mere thoughts and choose actions based on their values, not their fears. By applying these principles, we can guide our clients towards more fulfilling lives, rooted in what truly matters to them. Well, that's all for now. Stay tuned for forthcoming episodes, in which we'll present more practical psychotherapy tools through a case conceptualization lens to honor the launch of our subscription series Clinical Cases and our membership system Therapy Pro. If you're a psychologist, counselor, social worker, physician, MFT, or addiction professional, you'll find it invaluable for your practice. And the icing on the cake is you can earn CE credits that way. To learn more about membership, accreditation, and clinical cases, you can click on the link in the show notes. You can also access exclusive content that isn't included in this podcast. If you've enjoyed this, kindly help us to spread the word by leaving a review on Apple Podcasts and sharing news of it through social media or word of mouth. We very much appreciate your support. And thanks so much for tuning in. This is Dr. Jessica Díaz, and I'm looking forward to joining you again for the next episode. Bye-bye.